This show is for entertainment purposes only. Do not mistake this show for medical advice. If you or anyone you know is in need of a dentist, please contact 480-391-0099 to set up an appointment.
Welcome to our podcast. Sit back and relax. Dental Works Podcast. We're gonna share some facts. We gonna raise your dental IQ at the Dental Works Podcast. We will guide you. Put out some bad jokes before we are through. Free information here just for you. Sit back and have a good time.
Today is February 17th, 2023, and this is episode number 110 of the Dental Works Podcast, the show about learning the ins and outs of dentistry from a patient's perspective. I'm Ted Work, and that over there is Dr. Terry Work.
Peace out.
Dental Works is what are you leaving?
Home skizzies. Wait, is that what you say?
Yeah,
Good night.
That's what happens when you leave. Yeah, good luck. I'm Ted Work, and that over there is Dr. Terry Work. Dental Works is a family dental practice based in Scottsdale, Arizona that has been providing cosmetic and surgical dentistry for over 27 and a half
What I
years.
meant to
that
say
really
was-
rolls off the tongue.
What I meant to say was peace in. That means you're just getting it.
Yeah.
Peace in is what you say, and then peace out is what you say when you leave.
Dr. Terry hasn't watched the show, apparently, and just now realized our shoddy video quality on the podcast.
So here's what we're going to see if anybody notices. On the previous video, my hair was a little more gray than it is now.
Whoa.
Nobody
that is
noticed.
Pretty impressive.
Subtle changes is what we're doing. I'm going to Benjamin Button this shit. So I think by the 200th podcast, I'll be about 11.
11?
I think I've done the math.
Yeah, okay.
Yeah. So
It's exponential at a
Anyway,
certain point. It
next
kinda
week-
starts running away.
wig.
Yeah, next
Chest
episode
wig.
you
Chest
have like
wig.
the thickest,
Yeah.
curliest
I'm
hair.
going to have like a pompadour. Okay. Sorry. Oh,
Yeah,
one
that'd be
thing I
funny.
did notice is that
Yes.
my voice is really loud. And
Is it?
I always say, well, on the podcast.
In the
it sounds-
podcast?
Sounds like I'm enunciating too much.
Well-
so I'm going to slur my vision a little
No,
bit.
you slur your vision.
Yeah.
You know what? I use a tool that levels everything out, so we are
You are
both
a tool.
exactly the same loudness.
You are a tool.
Thanks.
I sound like I'm trying too hard. So I'm going to frickin'
You want to get a little bit more. You want to get really close.
ASMR.
If you get too quiet, then the podcast doesn't pick it up.
It's not about
because it has
quiet.
to
It's
be-
about I sound like I'm an idiot. You know, nobody likes the sound of their own voice. Anyway, let's move on.
I know
Sorry.
exactly what you're talking about.
Yeah.
All right. So today we have a special episode. This is Dr. Terry is going to be taking it away on this special episode all about, what are we talking about today?
Taking it away. Peace out.
You're taking it
We're going to
away.
be talking about smile designs. And
Oh, wow.
we have occasions. People will come
That
in.
sounds
they
so
don't
fascinating.
like their smile, and so what they'll do is they'll bring a picture of like Brooke Shields. I don't know why she came to mind. Somebody really good looked like. I want
Okay.
to look like this.
Sure.
And I want you to just change my teeth and make me look like this.
Right. That's like the
And-
lady who got a bunch of plastic surgery to look like J-Lo or
Yeah.
Any various number of
right.
celebrities.
So we went to Kevin Hart over the weekend.
Right.
And he talked about how everybody that gets too much plastic surgery is starting to look like ants. They have a big ass
With
and
BBL,
skinny waist, and their heads all look the same. And it's almost like there's only one plastic surgeon in every town, so every woman looks exactly the same.
Yeah. Well, I think they go to the same guy in Brazil. If I'm not mistaken.
Which kind of brings us to our subject is smile designs. And why is that important? If you go to a dentist and you say, I want a Hollywood smile or whatever, and they don't take a bunch of photographs and talk to you at length about, well, what is it you want, this and that, and all they do is say, well, yeah, let's prep those and take a impression and then send it to the lab. And when you come back, you'll have, a beautiful smile in 2 weeks or whatever. There's a lot that goes into evaluating and managing a patient's expectations is so important. And so the main steps of getting a patient exactly what they want just starts with, a lengthy question process to find out what it is they're looking for, and detailed photographs of their face. And the things that we look at is, and what the problem is as you're doing this process, I always feel like, hey, I'm just here to make you feel self-conscious, because you point out all sorts of stuff. Well, one eye's lowered than the other, and that ear is shaped
These
different.
people are never going to forget what you say. How you describe their face. This is just going to be burned into their memories.
I came in to get a smile design, and now I don't really want to live anymore.
For sure.
So, but the whole point is managing expectations. If you tell them, oh yeah, let me see that picture. Yeah, you'll look exactly like this, And they've got, like, when they smile now, they don't show any teeth.
Yeah.
Or they've got one eye that's not higher and inset 3 inches or whatever. But the whole point is,
what are you trying to?
You don't want to tell them. You don't want to tell them your teeth are terrible and they're your best feature. But what ends up happening is you have to look at things like, where we start is, your face is kind of split up into thirds. You've got the top, the middle, and the lower.
Here is exactly how you're ugly.
And so what you look at is interpupillary line should line up with your occlusal plane.
I'm so sorry. Before you go into this, I'm so sorry. You were saying before, there are people who don't put that much effort into how their face is going to look.
So you can go to a dental office and they'll be like, yeah, I can prep those teeth for you and then just have crowns made. And they let the lab do all the work, and they just kind of hope it turns out. And then they cement them in and they hope the patient likes it. Here at DentalWorks, where we care. No,
ASMR.
Here at DentalWorks, we take a lot of pride in making sure that we fulfill your expectations and we manage your expectations. So if I can't make you look like the photograph you want to look like, I'm going to tell you, because I don't want to be part of that thing. We're here to build long-term relationships. And one of those is, sometimes I will put someone in temporaries. A perfect example, gentleman we just saw, we started out, so he's like, here's what I want. Well, he's funny. His name's Rob, no last name. But what he said was, yeah, man, I'm going to get my teeth fixed. I'm going to get hair plugs, a tummy tuck, and then leave my wife. Obviously kidding. But he's a typical guy, very successful, but his whole life he's kind of taken care of his family and paid for stuff for them, but he's kind of like, now it's my turn.
Sure.
So he came in and I said, well, his teeth were crooked. He had some we couldn't save. We did multiple extractions. I think we ended up doing 7 or 8 implants, dental implants, but he had teeth that were not in alignment. So if you try to make a tooth look straight without putting it in its proper position, it just never turns out. So I told him, this is what we need to do. We need to get rid of any dental disease you have, teeth that are infected and that kind of stuff.
Yeah.
Because there's nothing worse than seeing somebody who's got brand new veneers in the front and then a whole bunch of abscesses on their back teeth.
I mean, sure.
And we get that all the time. It's like, you've got real health issues with your mouth and you're talking about getting bleaching.
Yeah.
So you have to really put it in an order that makes sense. And the first thing is get rid of dental disease, then restore the patient's ability to chew, and then restore their aesthetics. I know, I see that. So, and back to Rob, we basically, his teeth were out of alignment. So we did a bunch of temporaries so that we could get rid of the dental disease. We extracted some teeth. Then we did Invisalign and we moved the teeth so they were straight. And then we redid the temporaries, tried to make them ideal. And we left him in temporaries for 2, 3, maybe I think 4 months or whatever, because I wanted his family to have their input. His wife was like, no, they're too long. They're too this, they're too that. So we just cemented his upper permanent ones and he is absolutely thrilled with how they look. So if you just kind of guess and then you cement the permanent ones and they don't like them, well, what are you supposed to do? Cut them off and redo them? It's just, it's a big deal. And once a crown is cemented, they're not designed to come off. You can't just, we'll just take them off and have them adjusted or whatever.
Now, when you have to do that, what's the procedure like? What's the process?
For what?
For trying to get a permanently cemented crown off.
You just have to cut them off. You get the patient numb and cut them off, and it ruins the crown.
Like you split it.
Yeah, you split it down the middle and use a little tool that kind of cracks it in half.
That makes sense.
And so they're
jaws of life.
They're designed to stay on permanently, so you don't want to cement them. But again, every once in a while we get a patient where we do everything right and we think that we're looking good, and for whatever reason, their Aunt Martha makes fun of the way one tooth looks, and and then it's a whole "you never loved me" thing. But it doesn't. I mean, the point is you try to minimize the bad outcomes. But a lot of people, they want a smile that looks a certain way, but they're we talked about thirds of the face, but then there's also left to right.
Yeah, let's get back into that. What are the are there archetypal smile designs, or is it just like how it balances out, how it is mirrored and symmetrical, and the trying to get the golden ratio in your face?
Right. And so, golden ratio just talks about, your two front teeth should be 50% of your overall aesthetic zone, blah, blah, blah. No one cares. But we use that to kind of evaluate, because everybody's looked at someone and they smile and it looks like all their teeth are the same size. It looks like Mr.
I
Ed,
remember drawing a portrait that has that
piano keys, or you don't want flat teeth that are all the same size. The two front teeth should be approximately 50% of the width of the aesthetic zone, which is the distance between the two canines, blah, blah, blah. It doesn't matter. The point is, you have to match it to their face. If somebody has, you drew a picture of yourself and you've got like 35 front teeth. But the point is, point is, there's left and right symmetry. There's up and down proper distribution of space to where it looks pleasing to the eye. And sometimes you have to go outside the golden proportion to make it look aesthetically pleasing.
Sure.
And some people have a really, really curved lower lip. And if they have a curved lower lip when they smile and you put their teeth straight across, you've got a flat line and a curve that just doesn't look right.
You have to do the meniscus.
I don't know what you're saying.
It's like when you fill a graduated cylinder with liquid, it grips onto the sides. So you have to measure by the bottom of the lip line.
Yeah, you're talking about surface tension of liquids. That doesn't apply here, although saliva has.
You know what? I feel like there's some people who are going to.
You can always tell when he's lying because his voice goes. So anyway, back to this. So that's the whole point. You take really good photographs, retracted photographs, that kind of stuff. And some people, their arch is not arch shaped. It might be rounded in the front and then goes in on the sides. And if you try and build the crowns out to fill in their smile, then they have big undercuts in the there's a bunch of different stuff, because you don't only want it to look good, you want it to function well, you want it to be cleansable, and you want to teach them how to take care of it. It's a big investment. So you need to educate patients on how to take care of their smile once it's done. So, we're the type of practice that we're in for the long haul. So we want to see these patients for several years and we want them to function well. We have to make sure we don't give them jaw problems.
Yeah.
And then there's things of people have worn their teeth down to the gum line, and you have to, and what I always say is your chin is getting closer to your nose. And that's a really bad look. It's a very aging look when somebody's kind of like, when their lower lip is almost touching their nose. So you've got to get that back. But if you open them up too much, then they can't talk or eat. So all of this,
and they start looking like Gary Busey.
Right. All of this figures back into proper evaluation of the patient. And to be honest, there's a very, very small percentage of people where, you just can't do what they want. And if you start, then you have to be able to finish. Yeah. So the whole point is choose a healthcare provider that knows what they're doing.
What?
That's going to go into our next segment, which is going to.
Sure.
We won't say.
We will
now,
talk
but
about it.
We'll
Don't-
talk about
don't
it.
spoil
I won't
it.
Spoil it. Spoiler alert. But the whole point is, find somebody who is has a lot of experience in doing these kind of full mouth rehabilitations. If you look on our website, dentalwork.com, you can go to our photographs and see some of the cases we've done, and ask a lot of questions and make sure that your dentist has done cases like these.
Sure.
I'm going to show you some before and afters.
Yeah, we'll get some before and afters. Are you're going to send them to me? Like, so I can put them on this video, on this episode?
Yeah, we have a bunch of before
All
and
right, they're going to
afters.
be right here, probably up above. Before,
Yes.
after. Maybe
Yes.
I'll pause the episode so I can get a bunch of those in
Yeah.
there. All right. So here we are. We've got. We're gonna get into our next segment, which is. Sorry if I'm still a little congested. I'm recovering from a respiratory thing. It was a bummer. We're gonna get into one of my favorite segments. This one is the mailbox. Woo! We're doing the mailbox. So I've got some questions here from one. Did I write down their name?
Highland Schlabodkin.
That's exactly. I can't believe
Yeah,
you guessed it.
right.
That's
That's
incredible.
it's a pretty common name.
All right, so here we go. I got a few questions. These are some that I've heard, but I don't remember who they're from. So here we go. Highland Schlabop, whatever you just said. All right, here we go. It's been a long time since I visited the dentist. What do I need to do?
Boy, that's an open-ended question.
What do I need to
Call
do?
a dentist, 480-391-0099.
Okay, step one.
Yeah, that's really one of those things where it's almost like it's been so long since I've been to the dentist, I'm afraid to go. And
Yeah.
so
It's like doing your taxes.
A lot of people are like, I hate going to the dentist because all they do is talk about how I should have been flossing.
Well, then
We
floss.
try to not shame people for things that we can't change, and that's a big thing. People don't wanna- people don't-
when people tell me I'm not doing what I know I need to be doing.
People don't want to know bad things a lot of times, but I can tell you for sure, if you let it, the longer you let it go, the more expensive it's going to be, the more advanced problems you're going to have. And actually, a lot of people don't think of dentists as real doctors. I know I don't. But if you don't get these things taken care of, you can end up with some very severe health issues.
I think the question you need to ask yourself is if you're on a plane and someone is there a doctor on the plane? Whether you say yes or no is whether you're a real doctor or not.
Well-
right? That's. Do you qualify by like I'm a dentist though? Kind of.
Is there a doctor on the plane? I don't know what happened. Did someone chip a tooth? No. So the whole point is, what about Jill Biden's a doctor?
Well,
I'm a doctor of
not
education.
She's not saying she's a medical.
Is there
doctor,
a
though.
physician?
You know what's funny is PhDs actually existed before DMDs and all the other medical doctor.
A doctorate just means you have your doctorate.
Well,
in
yeah, it's
something.
just it's
You are a
exactly.
doctor in smart ass comments. So I think that
You know what? I was just saying.
Just here
I
now.
just said some words.
Okay. So back to here. What do I do? I haven't been in a while.
Yes.
Go to a dentist, tour their office, meet their staff. Most dental offices will allow you to come in and just see if it's a fit. We do a free evaluation consultation just to see if we think we can help you, just to see if it's a good fit personality wise. It's really important to have a connection with somebody because there's an excellent chance, if you haven't been in a long time, that you'll need to have a lot of work done, and you need to find an office where you feel comfortable. Nobody is going to be super excited about it.
Yeah.
However, you want to make sure that the office, you feel comfortable there and feel like they have your best interest in mind. So find an office for a free consultation.
Yes, for sure. Make sure you do that. Get checked. It's always better to know what's going on than to not know, in my opinion.
Well, right. And the explanation of the treatment can be very confusing. People don't know tooth numbers. They don't know. Just find an office that, speaks to your listening.
Sure. And if you don't know tooth numbers, listen to the very first episode of the Dental Works podcast
Yes.
where we count our teeth.
And where we
Try
were
to
afraid
make it to that point. It's rough. We get it. But
That first podcast was very ugly.
all right. So our next question, last question. Some would say our final question.
Okay.
Just as because that's a synonym.
What are you drawing it out? Is our
And for the final question, here we go.
can I call a friend?
You've actually already used your lifeline. So here we go. I have a cracked tooth.
Okay.
How should I proceed?
I have a cracked tooth.
They don't say, again, it's kind of similar with the previous question. They're not really saying they're in pain much.
Not a lot of. Okay, so
But-
cracked teeth are tricky because if you wait long enough, that crack will open up. You'll lose the tooth for sure. So you want to get it treated. And some cracked teeth have pain, some don't. Some you
Interesting.
can't see the crack, but there's pain when they, like on the back, when you bite down, it doesn't hurt so much, but when you let up, it hurts. And that's
Yeah.
a classic sign of
Interesting.
cracked tooth syndrome. So, I mean, the most important part of actually any medical procedure is proper diagnosis. You want to make sure.
Interesting.
Case in point, we had a patient that had some fillings done back east. I won't say what city. And
You just said
they-
that. I'll bleep it.
no. And so they had some fillings done, and she had terrible sensitivity.
Yeah.
And so she came here.
sensitivity.
Terrible sensitivity with some clam chowder. And so she came in. Her mother's a dentist, blah, blah, blah. It's a long story. Doesn't matter.
Yeah.
But she came in for evaluation. So I did pulp testing to check. And all of the teeth that had fillings done were sensitive to air.
Yeah.
Hot, cold. She
Right.
said it hurt all the time. And so we basically took radiographs and all that stuff. We got her numb. Got good isolation. And what we found was that when they did the fillings, they didn't get proper isolation. So there was a little bit of contamination of saliva in the fillings, and the fillings were leaking. And so that cold was causing expansion and contraction of the fillings. And that's what the sensitivity was.
Gotcha.
So we got great isolation using a rubber dam, blah, blah, blah. And then within 2 days, she was much better, could chew, could drink hot and cold stuff with no pain. So sometimes, and it's really frustrating because I went to the dentist, I was not having any pain, and now I have pain. And unfortunately, sometimes it feels like the cure is worse than the problem, but you just make sure to stay connected with your dentist to get that taken care of. They told her that, it's just, you got to let it wait. Well, she waited 5 months and it wasn't getting any
Sure.
better. And so we figured out what was going on. So
Sure.
the whole point of this is proper diagnosis is so important. And sometimes you need to get a second opinion to see what's going on. So
Sure. All right. And with that, we're going to move on to our favorite segment, which is Celebrity Smiles. Please remember, you can follow along with the images that we are seeing on the Instagram page or on the video. Please just watch the video because that's easier to do. I'm making the video anyway. Just watch the
don't
video.
watch it while you're driving.
Don't watch. We make an audio only podcast for that exact reason.
We do?
Yeah, we have. Yes,
It's both?
audio only. Yes. Yeah. It's
Well,
both.
it depends on what you're watching it on. If you watch it on YouTube.
Well, no, you can't watch it when it's audio only.
But I'm just saying, who would want to miss out on this?
Well, maybe wait till we have a better camera.
We're getting a new
watch the
camera
video.
today. Our viewership has really decreased.
Okay. Yeah,
No. So we're raising the level of.
I hope you appreciated when we did our Celebrity Smiles in the past for Kurtwood Smith. I used the painting of Kurtwood Smith. I know Terry would appreciate
Yeah, that was.
that. All right, so
Celebrity.
I've been watching this show on Netflix.
Oh, God.
It is a Korean drama about lawyers, and it's called The Extraordinary Attorney Woo.
Oh, I started to watch.
Did you kind of watch it a little bit?
Yeah, a little bit.
It's about a lady who has autism but also knows the law real good. It's a goofy, weird
Real
show.
well.
It's
Real good.
good. Anyway, you should watch it. It's heartwarming in many ways. She likes whales. Anyway, we're going to be talking about the first person or the main character from such a show and her teeth. Her name is Park Yoon Bin. Go ahead and just read that because EUN-BIN.
EUN.
We apologize to our South
she's
Korean listeners. Go ahead and look at her
Oh,
teeth.
she's got really nice teeth.
You could type in teeth also to try and...
Yeah. So, very natural. She might have a couple crowns on the front. Wow. And again, this speaks to, you're going to put it up right here, right?
Probably down here.
Down here.
I think it's in between us.
Can you put my hand in front and say, her smile? No.
No.
You can't.
I
do it
can't.
that
No,
way.
I don't have superimposition.
Would it help to have a different video camera?
Well, if we had green screen.
Green
we
screen.
could-
We have green screen that you won't use, you big baby.
It's not that I won't use it.
So
It's
she's
just-
got a nice smile. Yeah, she's a 9.
9.
9, not German 9.
Not
that
German
means no.
9. No.
9. No.
Speaking
she's
of
a 9.
Germans,
Cute.
I'm just joking.
Yes. She's German?
No, she's not. No.
She's East
South
German?
Korean, I'm pretty sure. So dumb.
No, super East German.
Yeah, so we're giving her a 9.
9.
Awesome. Excellent. That's a wonderful smile. You should watch that show. It's pretty fun.
Well,
Yeah, you know what? I actually just really like it because
is it subtitles?
there's subtitles
I'm out.
and it's dubbed.
Oh,
It's
God.
dubbed, so you can just listen to it.
Dubstepped? Wicka wicka. That actually would be pretty entertaining. Wicka wicka wicka.
Every time they talk, it's like... All
right.
That would be funny.
Okay. Next.
All right, the next person is someone that Miranda told me to do, and his name is J.K. Simmons. You know J.K. Simmons. I don't remember his name, but he's the guy from Spider-Man.
Spider-Man.
Give me that Spider-Man.
No, he's also from that drum show. That's so dumb.
Whiplash?
Yes.
That is a dumb movie.
dumb.
That is a dumb movie because
J.K.
everybody knows that
What's his name?
Simmons.
Simmons.
J.K. Simmons. He's also the guy from Portal 2.
Okay, that dude's got crazy range. He has been,
He's great. He's
he
funny.
Has been,
he's great in the Farmers commercials. Is it Farmers?
he is not freaking lazy, I'll tell you that.
Spider-Man?
Spider-Man.
Everybody knows that the way that you get good at the drum set is by being abused.
Yes.
And that's the only
And
way to do
drum until you bleed.
it. Yeah.
That's what I was always just like,
Oh my God, there's blood all over it. What the hell?
Ted has been a drummer since he was 14. I've never seen blood all over the
I've
drums.
accidentally smashed my finger on the
Well-
drums and bled a little bit, and that sucks. I don't want that to happen.
Yeah,
That's
so he's
bad.
got all crowns across.
Okay,
and this is a
yeah.
perfect example of somebody who they should have made his 2 front teeth a little bit longer.
Okay, I mean, I think they look fine, but maybe
Yeah,
it's
and
just
he needs
because
a little
I'm-
Botox. He's got some
Maybe
pretty
I'm-
wicked crow's feet. But
Oh man,
I'm
going
to give him a
though.
5.
5. We're giving a 5.
But that's a
to J.K.
perfect
Simmons.
example. He could handle a little bit.
I think his teeth look very unobtrusive. Like they're not
Unobtrusive.
they're not drawing.
They're not
attention.
sticking out so far where
Well,
they
yeah, they're-
invade my personal
They're not.
space.
You know what? They're kind of a side
Yes.
element to the face that
Well,
just
he's
complements.
unfortunately, you're supposed to measure in thirds. His forehead starts at the back of his head.
Yeah, no,
So
for sure.
that makes it a little bit tricky. But we're just here to point out stuff that we're perfect.
Again,
obviously.
no, of course. And you know what?
What did I say? 5?
5, I think.
5.
Yeah, you're giving him a 5. All right, the last person is someone who is in the second season of one show called The White Lotus. I know you haven't seen it. 'Cause
I've tried to
HBO.
watch that show, but I'm
It's
not going to pay for
it's-
cable.
It's. I get what it's doing. It's just a lot of the time it makes me so uncomfortable because all the people are such terrible people.
Yeah, that's always hard.
So it's like-
have you seen The Glass Onion?
No, I haven't. I've heard it's good though.
It's not good. at
I've heard
all.
it's- I've heard it's
terrible.
pretty good.
It's terrible. But who are we
Anyway,
looking for?
the last person is one Aubrey Plaza. Aubrey Plaza. I don't believe we've done her before, but she was in Parks and Rec. If you remember Parks and Rec with Ron Swanson.
She's
He's like, only fish for sport, never for food. It's practically a
So-
vegetable.
she is. So yeah, she's got a diastema, which I used
Sure.
to have one, so it's very Arnold Schwarzenegger.
So it's personal at this point?
But she's got a really low
It's
smile on.
personal.
Her teeth are natural,
Sure.
which is nice. A little
Sure, bud.
diastema she could do, She's got a pretty pleasant smile, but it's still I'm going to give her a 7 because she's got some wear. You can see on some of these photographs, you can see she's got wear on her front teeth.
Yeah.
And they're getting kind of thin. But yeah, she's a 7. She's got a nice, pleasant smile. Unobtrusive.
Yeah.
I don't even know what that means. But yeah, she's a 7.
It's not distracting. I guess
But,
distracting.
well,
is
you
the
know
word
what?
I meant to
She's
say.
got an 8 because she doesn't have a lot of restoration. She's kept it pretty natural.
Do you think she had
7.
braces at some point?
It's hard to tell, but she's got some spacing between her teeth, so I'm
They
gonna
look
7.
fine. They
7.
can't be saying
7.
spacing. All right, 7 for Aubrey Plaza, and with that, we're going to be bringing it to a close. Peace out. Thank you for listening to the Dental Works podcast. If you'd like to support the show, please give us a rating on iTunes or your podcast player of choice. If you'd like to get in contact with the show or you have any questions, please send an email to dentalworkspodcast@gmail.com. Not the dentalworkspodcast@gmail.com. I shouldn't have clarified this because now it's even more confusing. dentalworkspodcast@gmail.com is the email. We may talk about your question on the show. If you're located in the Phoenix area and need dental work, please give us a call at 480-391-0099. Terry, thanks for joining me today.
Absolutely. It's a good one. And I see Kristen in the background.
Who?
She's going to be
You can't. Hey, you're
coming
spoiling things.
onto.
We can't.
She's going to
nobody
be
knows
coming
that-
onto our podcast
Nobody-
eventually, but
Nobody
she's
knows
kinda
that
shy.
she exists yet. This podcast was produced by T-Door Productions. Theme song written and recorded by Neil Hathaway. Vocals by Terry Work. Sound effects provided by freesfx.com and zapsplat.com.